come over here.
Who?
This way. We've got.
I'll hold one.
Go.
Well, this is a
Oh,
good
you guys got to
angle.
be together?
Yeah.
Is it a good angle?
Is the angle okay?
Yeah.
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 Okay.
You guys are on live now, so.
Oh, we are.
Oh, great.
All right.
Yes.
So, hey, let's get started. Welcome to our virtual happy hour. We're just getting everything set. We just finished with patients. We're going to relax a little bit. Nice deep breaths. Thank you for coming. Dr. H.O. Greenberg.
I'm Dr. David Cotter, and together we're the Derm Bros here at Las Vegas Dermatology.
Party.
Our happy hour.
Cheers. Water here for me.
It's been a long day, but a good day. And we're excited to have you here. We have a number of questions that people have written in on our info at lvderm.com. You can always email us with questions. You can call the office at 702-456-3120. That's our number to make an appointment. We've got a bunch of information online.
Absolutely. We've got some exciting things to share with everyone today, too. We're really blown away by the support and positive feedback we had a few weeks ago. And so today, we wanted to start off by potentially sharing with you guys some logos that we are in this process of commissioning for the Derm Bros. Dr. Greenberg, was there a particular one you wanted to start with?
I think this one's good, but first, cheers.
Cheers, my
Cheers
friend.
to round two.
Round two.
Round two. It's been a long week. So yeah, go ahead with the first one. This one, actually.
So we were crowdsourcing designs for kind of two guys that are talking about dermatology. We wanted them to incorporate the term the Derm Bros, maybe our likenesses. And so we did a crowdsource platform with graphic designers. And this is one of the early designs that came up. We wanted to share that with everyone.
Yeah.
Dr. Greenberg, I know you really like that.
I really enjoyed it. I thought it sort of captured our essence. It was from, I listened to a podcast called The Jordan Harbinger Show, and this is one of their sponsors. But besides that one, this was another one that we liked. This was an early winner.
Super cute.
And then for this one, I know Dr. Greenberg really liked it, but
I do. I like Dr. Cotter's teeth.
They didn't quite get my girl right, so we're going to have to pass on this one. And as of right now, these are the next two that are the early winners and leading the pack.
Yeah.
So both a kind of a clean, sleek, professional one as well as a fun one with our likenesses. And so there's still more designs to be submitted over the next week, and so we'll see what they have to offer.
That's great. So now that we've gotten this out of the way, you can read our bios on LasVegasDermatology.com to see our backgrounds. But I know that there have been a lot of people who had a bunch of questions. We also may have a special guest coming by to deliver some Sin City cupcakes during the show, which will be nice. Those are alcohol-infused cupcakes. So, Dr. Cotter, ladies,
with that,
we're ready for your questions.
Okay, so we did have some people send in lots of questions. So I guess we'll start with the first question. First question is to Dr. Greenberg and Dr. Cotter. It says, thank you so much for your time and willingness to respond to spontaneous questions from several clients and followers. My question is mostly about skincare routines. My father has severe cystic acne, and I fear my skin has started down the same path. I've always had mild acne, but a few months ago I dyed my hair and got a huge cyst on my head. Shortly after, I started developing bigger and more painful zits on my cheeks. I also want to mention I'm 26 and I've never had guidance on skincare nor researched it until recently, so my question may be silly. Sorry in advance. And here are the questions as follows. What does a standard skincare routine need to include, and how much is considered too much in your skincare routine?
Well, so I'm a keep it simple type of guy, and I like to think cleanse, moisturize, sun protect, medicate. So in the morning you're cleansed, moisturizing, sun protecting. At nighttime you're cleansing, moisturizing, and medicating. And maybe for some people they need a night cream as well. But I like to keep it simple because that's all I can remember to do. I like a gentle cleanser, something like a Cetaphil. Some people really like foaming facial cleansers, I think are nice. For a sunscreen in the morning, I like something that's also simple and has a moisturizer built into it. Usually things with titanium or zinc, you can get micronized zinc now, which is a physical blocker that doesn't paste you out, so it doesn't leave that residue of kind of whitey film on your face. Now, there are some patients, though, that a gentle skin cleansing regimen is not going to be adequate, and those are patients maybe like yourself, and you're describing having severe acne breakouts, and for patients like that, they need to kind of step it up to the next level, and that's where we add the Medicate to the cleanse, moisturize, medicate, and medications can come in a variety of different manners. All of my acne patients are on a topical regimen, and I usually try to give them a topical medication that prevents acne and doubles as an anti-aging medicine as well. And then beyond that, some patients need oral medications too. What do you think, Dr. Greenberg?
No, I concur. There's a lot of different ways to treat acne. Wash, medicate, moisturize. I have a YouTube video on our Las Vegas Dermatology YouTube channel. Talk about the top 10 acne treatment options. From all the topicals we talked about, hydrofacial, chemical peel, microdermabrasion, a lot of these things we can't do right now, but in the future, those are things you can do. Clarisonic brush to wash the face with. If the acne is as severe as you say, you may need Accutane, which is the most, this is the strongest medication that we have. 5-month course of drug involves blood draws while you're on it. And for the cyst on the scalp that you mentioned, there's some cyst videos on our website, but it's most likely a pilar cyst, which can be excised and you'll move on with a couple stitches.
Okay. Mike Levine, LV on Instagram says, the first one is the best with a laughing emoji. Steel32 Fitness says, you guys are awesome. And if you guys needed to see what it was, this is the one that they're talking about.
We're still trying to decide if this may be the winner.
And then second question goes, how often should you exfoliate? And if you use an exfoliation system that has a cream step, do you skip your daily moisturizer?
Okay.
No, you can take that one.
I think for some of these kind of aesthetic skincare questions, we should have a special guest at some point. We have an outstanding esthetician who's medically and laser trained as well. Her name's Autumn, and she's been working here for over 5 years. And she does a great job answering many of these types of questions. And there's no one-size-fits-all for exfoliating, and that's because some people have more of a dry tendency, some people have more of an oily tendency. But it is good to get out the dead skin, and that can be done in a variety of different ways. With over-the-counter exfoliating kits, you can use something like a Clarisonic brush to remove dead skin. You could even come in and do facials and things like that. Every patient is different, is kind of my take on that.
Yeah, and I would say that if you do have acne bumps, there's a lot of at-home regimens. Some people use toothpaste, over-the-counter benzoyl peroxide, which is fine. Even different over-the-counter can be purchased at Target. So there are those options. Topical antibiotics. It's worth getting a medical evaluation to see if it is acne, because maybe you think it's acne, but it's something else.
Okay, so we have some from Facebook saying, Jennifer Church Kilkenny says, so happy hour was literal.
It's been a long week, Jennifer.
Michelle Jackson says, hi. And Nicole Whitaker says, how can I get rid of dark spots on my face? I use SPF of at least 30 daily.
Well, you're already doing the #1 kind of pillar of skincare when it comes to preventing and treating dark spots. You always want to be sun protecting. Most dark spot regimens are cosmetic in nature, meaning that insurance won't cover it, so you have to pay for it yourself. And you should secure your investment, if you will, by using sunscreen. And then some of my favorite things to use for dark spots on the face are bleaching creams, prescription bleaching creams, and lightening agents, as well as non-bleaching lightening agents. There's some brightening skincare lines that don't have a bleaching agent, so they don't have those potential side effects, but will brighten your skin. And then beyond that, I use a tattoo removal laser, often for patients of the right skin type, to be able to gently remove dark spots. Sometimes chemical peels are helpful, but again, it depends on how dark the spots are, what the reason for the dark spots are, and then what the patient's background skin color is, because we have to be very careful to not make dark spots worse with things like cosmetic treatments.
No, I would agree. And with the Q-switch YAG laser that we use, which is our tattoo removal laser, it's really good for any skin color. It doesn't discriminate. We do have an apogee laser, which is a 755 nanometer laser, which is good for very fair skinned people, skin types 1 or 2, with dark spots. So depending on your skin color, that will determine which device we can use.
Oh, Synergy Mid-Sales just joined.
Oh. Exactly.
Christina Holmes asks, can I get free fillers and Botox with laughing emojis? So a Steel 32 Fitness asks, thoughts on hydroquinone pre and post treatment?
Yeah, I think hydroquinone is still a good foundation for a lot of skin lightening and skin brightening regimens, but you have to be very careful with hydroquinone. It can cause actually darkening with unrestrained use. You can get something called exogenous ochronosis, which is paradoxical skin darkening, and it's related to the way the medicine actually prevents pigment can lead to a different type of pigment deposition in the skin. And that condition, ochronosis, is very, very difficult to treat, almost impossible. So all of my patients that are on a hydroquinone-based regimen, I alternate them between a hydroquinone-based medication and a non-hydroquinone-based medication. So for example, I use a lot of a compounded medication that has a topical retinoid, a hydroquinone, as well as a topical steroid for 1 month, and then I'll follow that with a non-hydroquinone lightening agent like Light Hair 2.0, which has cosmeceuticals and more botanic and natural ingredients that will be skin brightening without having that hydroquinone component.
Yeah, and the hydrofacial is good for removing dead skin. There's a couple different brightening agents that can be used in that. No matter what you do, if you have dark skin or dark spots on your skin, it's not going to go away with one treatment. You're going to do a series of treatment. It's going to take a year or two to get to the color that you want. Same thing goes for if you have any acne scars, large pores, fine lines. No matter what you do, it's going to take time. It's like going to the gym. You don't go to the gym one time and come out with these massive muscles looking like Arnold Schwarzenegger and you're going to win a competition. It takes time. That people come in 70, 80 years old, never done anything for their skin, and say they want to look 20 years younger, and it's just impossible.
Brianna Cotter says hi.
Hey, thanks, Bree.
Alrighty, awesome. And then we also have a question from Bliss06 on Instagram asking, hi doctors, what eye cream and moisturizer would you recommend for pregnant women? I use Neocutis eye cream, but not sure if that would be safe when pregnant.
Dr. Greenberg loves the Neocutis line. He really is an expert on many of their products, but specifically you want to make sure there isn't an ingredient that could have potential fetal harm. Most over-the-counter products are safe, but there are a few that are not. For example, benzoyl peroxide, which wouldn't be in your night cream, but is something you could go buy at Walmart, Target, CVS for $2 to $5, is pregnancy category C, meaning not safe in pregnancy. So you just have to be very careful. Usually when my pregnant patients come into the office and they have specific questions about products, we either pull up the ingredient list in the office or have them bring the product so we can review each ingredient specifically and determine if it's safe.
Yeah, I would agree that the pregnant women are in a special category. You just got to be a little bit more cautious.
Okay. Bake03 on Instagram is asking, I have a rash around my eyes and it itches. Maybe it's allergies, or do you think it's stress?
Can I take this one?
Yeah, please, Dr. Greenberg.
The highlight of my day before the test results came back, the highlight of my day was a patient who came in for some patch testing. Thought she was allergic to some one of her eyeshadows. We do comprehensive testing where we test against the 80 things that people are most commonly allergic to. As well as people bringing their own products. Turns out she was allergic to CeraVe foaming cleanser, and then none of her eyeshadow products was she allergic to, but she was allergic to rubber. And I said, I don't understand, but you're allergic to rubber. She goes, oh my God, I curl my eyelashes with this eyelash curler, but there is a piece of black rubber on the eyelash curler that she was allergic to. So it's quite possible that you're allergic to something like that. It's worth evaluating. Some people are allergic to acrylic nails. I know that it's gotten really ugly out there because nobody's been able to go to nail salons or any kind of, hair salons or anything like that. So maybe you don't have acrylic nails, but something that you touch in the environment can involve your eyes.
Yeah, absolutely. I would completely echo Dr. Greenberg. I think when I see a patient with an eyelid rash, an itchy, scaly red rash around the eyes, I always think about intrinsic eczema that can just show up as a cause of eyelid dermatitis in adults, as well as contact dermatitis, like Dr. Greenberg's saying. And one of the severe cases I've had during the COVID pandemic, seeing only essential dermatology, is a woman who actually flew in from Reno for what started as an eyelid dermatitis, but turned into an entire total body rash, and she ended up having a severe autoimmune disease causing that. So it's really important to make sure that you're being fully evaluated, because there's even, again, severe autoimmune diseases that can give eye rashes, which is why it's good to come in and see an expert.
Alyssa Bradford from Instagram on Dr. Cotter's says, just turned 50 and ready to explore injectables. Once I go down that road, is there no going back?
Well, happy birthday. You can always go back, you just might not want to. And so once people start kind of on a cosmetic plan, and I would call it a plan because you don't want to do everything in one day, especially if you've never done anything before. What we should do is sit down together, go over your skin goals, and figure out what the best combination of either injectables or lasers or skin tightening devices or lifting procedures could be done to get you to where you want to be with your skin. Now, a lot of the fillers that we use here in the office, they're all hyaluronic acid based, so they last anywhere between 6 and 18 months, depending on the specific filler. And that means that, yeah, over time, the filler will be reabsorbed by your body, and you may want more to supplement that back. Things like Botox, which is an injectable neuromodulator that helps soften and relax the muscles of facial expression so you don't make wrinkles, usually lasts for about 3 months. So the good news is if you've never had it and you hate it, well, it's gonna be gone in 3 months. But the bad news is you'll probably love it, and then it'll be gone in 3 months.
Yeah, it's funny because I asked Dr. Cotter what I needed to look younger, and he had done a full face laser resurfacing on me about a month and a half, 2 months ago. And then he wanted to inject my neck with Kybella to get rid of the fat under the neck, and he wanted to fill my lips with filler because I don't have an upper lip. And I didn't want to do it because I didn't think that I needed fuller lips, but he did it, and I was actually happy that I had developed somewhat of an upper lip after that.
And I think once we're restricted, the restrictions are lifted off non-essential medical services, I'd be happy to give you another treatment, Dr. Greenberg.
Thank you.
Okay. Is collagen actually an important part of a skincare routine?
Topical collagen?
So collagen is an essential component of your skin in the dermis. It's what gives a lot of the fullness to your face and the volume and the contour. Topical collagens have become increasingly popular, and there's a lot of questions regarding how they work, do they work, do they actually get into the skin? There's even ingestible collagens that some people will take, not just for uses in the past, which include joint pain, but also the idea that it's going to somehow get back into the skin. I personally don't think that ingestible collagens work, but I have seen some data that suggests that some of these topical collagen and skin pumping products actually do somehow integrate into the dermis. And how that happens, if it's through pores or not, is really unclear to me. I think these are early days. And what I tell all my patients is if you have a product that you, but I like to build your pyramid for your skincare, and things like topical collagens, those are kind of like the top of the pyramid. You've got to make sure everything else is good before we go there. So it's all about investing your money and your time in things that are going to give you the biggest return. I think things like topical collagens right now are probably on the lower end of the return, but not necessarily bad.
Yeah, I'd want to see some photos before and afters. Cosmeceuticals is such a great area. I just had a patient today who's using bone marrow, topical bone marrow from people. And I've never heard of that before.
Okay. On Instagram, Wingate702 says, my daughter has very red, coarse hands. She is a competitive gymnast. Her hands look like she's wearing a red glove. She's not using chalk during the quarantine.
Wow.
So there's a lot of causes of hand dermatitis. Depending on her age, certain things may or may not be less common. Intrinsic eczema, autoimmune disease, sometimes psoriasis can even show up on the hands. There's other diseases in children specifically that show up on the hands that really have to be seen to make the diagnosis. Also, it'd be helpful to know if this is something that's been present since birth, because there are some genetic skin conditions, some ichthyoses that can show up with kind of a reddish basketball texture to the hands. That's associated with eye problems and hearing problems sometimes. Or if it's something that more recently came up in the last few months, I'd really be concerned about contact dermatitis as well. In general, there's lots of things that we can do to treat it. It just depends on the etiology.
Yeah, we've been talking about like the COVID toe, which is like a pernio or a redness of the digits. We had a woman yesterday who had just some black discoloration of her hands. We looked at them together and looked at it under the microscope. She has something called tinea nigra. So there's a lot of different things that can cause discoloration of the hands.
For most patients, that if they have rough hands and thickening of the skin, a safe option for most people, I'm not saying that this would necessarily apply here, but for thickened roughness on the hands, I like just an over-the-counter urea 20% cream. It's nice, it's moisturizing, and it also helps exfoliate skin.
Sounds fine.
Surly Man 72 says.
Nice handle.
Go blue.
It's an even nicer question. It says, I get a rash every time Michigan loses to Ohio State. Dr. Greenberg, will we ever beat Ohio State again?
Nice to hear from you, Dan. Yes, that's my prediction. My prediction is that we will win the next year if we have football. I mean, it's a crazy time right now for the country. So, thanks for your question.
Awesome.
And sorry to hear about the rash. I get it too.
Jenny_bugs says, sorry if it was already asked, but what's the best treatment for reversing sun damage?
Number one would be avoid it. So avoid sun damage if possible. Don't go to a tanning booth if possible. Anything that you do now just compounds upon the damage that's been done in the past. So avoiding the sun is the way to go.
Okay. When should toner be applied, and is toner necessary?
So I have a lot of toner conversations with pretty much all of my new acne patients. A lot of people like to use toners, and some people may need to use them depending on the quality of their skin. When I have a patient come in for an initial consult, I ask them to stop any non-prescription medications, because a lot of times we start adding in prescription acne medications, prescription anti-aging medications, and they become too abrasive when used in combination with the toner. So depending on the specific patient, we may add back in toners, but sometimes if you have very oily skin, you're having a hard time cleansing, that can be helpful. I think Dr. Greenberg has a drop-in
My hand was
question.
on.
Yeah, we have a drop-in question. I put it on my mug here. It says, is granuloma annulare an autoimmune condition? And are there any anomalies, any commonalities to people that have this condition? What are the latest treatment options? So granuloma annulare is an annular eruption. Annular just means coin-shaped with a central clearing and a rolled border. So it is associated with diabetes. It's not caused by diabetes, but people who have diabetes tend to have more granuloma annulare. It's a very difficult condition to treat. There is no cure. There's some control. There is no FDA-approved treatment. Sometimes I inject these with steroids. Sometimes I use topical steroids. Sometimes I use topical immunomodulators like Protopic. But it's a very difficult treatment. In terms of the latest treatment option, I would say just the things that we talked about.
Yeah, I absolutely agree. I see a lot of pediatric dermatology, and this is a very common diagnosis in kids, actually. In kids, you always want to be safe first. And I always tell all of my families that granuloma annulare, first and foremost, is not a harmful condition. Some patients are very bothered by either itch, sometimes even pain associated with it, or cosmetically disfiguring lesions. Some people can have GA on their hands or their face, and that can be very bothersome to them, and we treat those patients more aggressively. By definition, it's not an autoimmune disease, meaning that there's not a known antigen in the skin that the immune system reacts against, but it is a type of autoinflammatory condition, meaning that there's inflammation in the skin, we don't exactly understand why. For some patients, it will go away on its own. Other patients, it will stay the same for years. Other patients, it may spread. For patients that have what we call disseminated or generalized granuloma annulare, that means many lesions all over the body. There are some immunosuppressive and immunomodulatory agents that can be used, but for most patients, the risks of those medicines outweigh the benefits. There have been some nice case series studied or published in the last few years. One using a TNF-alpha inhibitor called infliximab, which is an infusion, as well as others like Humira or adalimumab. These are all off-label medications for that, but have been very helpful. You can also use conventional disease-modifying anti-rheumatic drugs like cyclosporin, methotrexate. Those have toxicity profiles that, for most of my patients, especially my pediatric patients, that the risks don't. The risk outweighs the benefit. So usually we treat with topicals like Dr. Greenberg says, inject patients that want injections, or we just kind of follow them over time, and if it evolves, we address it.
Yeah, I've had multiple people with this condition and with this condition severe over years, and I have used all the drugs that you mentioned, including adalimumab. So it's just getting them approved, and it's a tough condition.
All right, Lee. Ellie.01 on Instagram asks, does wearing makeup concealer frequently under dark circles make them worse and dry your under eyes? Actually, I'd like to know that too.
I think it depends on the makeup.
Yeah,
I think it does.
I think there's a lot of issues
Mine-
with cause and effect, and sometimes it's not even the makeup that you're putting on, but it's what you're having to use to take it off. Because makeups, specifically concealers, they're built to conceal, so they adhere really well to the skin. So a lot of times people will be using maybe a very irritating agent to remove it, and vigorously rubbing. Just vigorous rubbing of the under eyes can lead to dark circles. That's something called the allergic shiner. So we see that a lot of times in our patients with eczema because they also have really bad seasonal allergies. So you're always rubbing this area and you can get darkening just from that alone. So naming cause and effect is tough, but certainly over manipulation of any area of the skin can lead to darkening, specifically the under eyes.
Oakley dokley. Lou Balmori Zacharias Tevez says, hello, good looking doctors. And then Tierra Armani Morris on Facebook says, what do you do with underlying cysts on the center breastbone, opening and sometimes unopened pockets, secretes through pores and gets a bump when pus inside of it, and it hurts? What would be the options to get rid of it? It was active for years and then it died down and then now it's active again.
First of all, I'll say I'm really sorry to hear this is going on. It sounds terrible and painful and probably very, very frustrating. Without knowing exactly, seeing you and knowing exactly what you have, it sounds like you could have a condition called Hidradenitis suppurativa, or HS, which is another very severe, lifelong autoinflammatory condition that needs treatment and needs medical treatment to prevent flares and prevent scarring over the long term. There's only one FDA-approved medication for that condition, and it's an injectable medicine called adalimumab or Humira. There's many off-label medications I use for those patients as well. Just depends on what the patient needs and what their risk factors are. But sometimes antibiotics are in order. Sometimes injections of steroid medicines into the cyst help. Sometimes blood pressure medicine called spironolactone can help. Sometimes actually a diabetes medicine called metformin can help. Sometimes birth control pills can help. And I'm sure Dr. Greenberg's probably prescribed all and more of these medications. But every patient is different. It sounds like you would be best served with a consult, and I'm sorry to hear that that's going on.
Yeah, I would agree with that. Sometimes incision and drainage into the cyst can be useful. Ultimately, the cyst itself may need to be excised. And lately, I've been doing a lot of bleach baths, which is like half a cup of Clorox and a full cup of bath water, just to decrease bacterial counts. There's different theories on whether that works or not. Like HibiCleanse, which is an over-the-counter, but is a cleansing agent. Yeah, that can be used to clean the area too.
She replied and she said, it died down, but I had bariatric surgery, so I feel like it came back. I lost 150 pounds, but thank you. I will make an appointment. And you can call right now.
150 pounds is awesome. Nice job.
Cat Bird says, what can you do about puffy eyes?
Those are tough.
Well, again, it always depends on the etiology. If it's puffy above or below the eyes, is it the upper lid, the lower lid, is it both? Is it related to an allergic component? Is it related to something called a severe version of rosacea called solid facial edema? I have a few patients that I take care of with eyelid swelling related to the rosacea. Or is it related to age-related changes of the skin that's best addressed with a surgical procedure with like an oculoplastic surgeon?
She said it is below.
Okay, so puffy lower eyelids, it may be allergic in nature, it may be age-related. It's hard to know if it's age-related. Sometimes the best treatments can be cosmetic in nature. Dr. Greenberg, I know, likes to do a lot of lasers around the eyes and
Sure.
gets great results.
Yeah, there's something called the Madonna lift where you laser carbon dioxide resurfacing laser just around the orbit itself, below the eyebrow and above the cheek.
She said, yes, I also do have rosacea. Jennifer Church Kilkenny said, how do you treat under eye circles in patients who have severe but well-managed allergies?
Just as above,
Yeah.
do the same thing. Those under eye circles are really difficult, and sometimes they can be familial, where you'll have just somebody who has dark circles around their eyes, and it could just be that that's their heritage and that's their lot in life.
And sometimes the dark circles, it's because of loss of volume. So what you're really seeing is a shadow being cast, and it's not the skin quality itself. And adding back that volume with a filler can sometimes help patients.
Yeah, the problem with filler, and it's great in that area, is it's unforgiving. So you could get like a Tyndall effect, which means that you can see some bluish discoloration with the hyaluronic acid fillers.
Thank you. Susan Sayadella says, what's the best way to get rid of skin tags, especially on eyelids?
I mean, my
Cut 'em
favorite
off.
way is just to numb them up, pick them up with little tiny delicate forceps and snip them off. Works great. But in office with lidocaine. And very steady hands.
Jennifer Church Kilkenny said, thank you.
You're welcome.
Jenny_Bugs says, besides avoiding the sun, using moisturizers, and applying sunscreen, what do you recommend for anti-aging?
Oh man, that's like saying that I want to have a nice fit body. What do I do? A million things.
Well, maybe we could paint out a couple of different patient phenotypes, so specific types of patients and the types of problems that may come along with aging, and then we could talk about theoretically how we would address each one of those. So, like for someone who has lots of sun damage that's manifested primarily with fine lines and wrinkles and maybe some looseness to the skin, how would you treat that patient?
So lots of sun damage, plus fine lines and wrinkles. So a carbon dioxide resurfacing laser, so resurface the skin, and then a series of laser facials to get rid of brown spots, and then filler if the volume, depending on, if it's fine lines, then no filler, but if it's deeper lines, then filler.
I agree with that. I think, if you have lots of lines related to sun damage and age-related volume loss, doing a CO2 laser is really nice because it boosts collagen production. It helps the skin remodel, helps overall the quality of the skin and the appearance. It has more downtime though, it's a little more aggressive, so it may not be the best treatment for every patient. And then we see some patients that have mostly freckling, and they have what we call dyspigmentation, so brown spots, white spots, and maybe even some redness and broken blood vessels related to the sun damage. And
Yeah,
what do you think about that, Dr.?
So the Venus Viva is a radiofrequency device. Needles rest on top of the skin, heats and tightens the skin. Do that with microneedling on top of it. I put rich plasma, maybe do a couple carbon dioxide treatments in between. I mean, again, all of this stuff, to get the nice fit body, to get the nice, good-looking skin, is going to take a series of treatments over a long. So those maintenance treatments, the microneedling and the radiofrequency as your maintenance treatments are fantastic in between treatments to just enhance and improve the skin quality that you have. And then a good topical regimen and finding good topical care. Retinoids, FDA approved for fine lines and wrinkles. You can do human growth factor topicals, which is in a lot of the Neocutis products. There's a ton of options.
Yeah, I think that's great. I agree.
Yeah.
Awesome. I have another question from Loango _. It says, how do you get rid of dark spots or freckles?
So the lasers that we talked about, the chemical peels, fading creams, all that stuff helps. Now, if those are flat, if they're dark spots that have a substance to them, that have a thickness, they could be what are called seborrheic keratoses, which are waxy, greasy, stuck on spots that you get as you get older. More turns around the sun, more spots. There could also be some oil glands that you have. All that stuff can be either melted off or frozen off, depending on what you have.
Okay, I also have another question that says, recommendations for sensitive skin prone to acne and is combination of oily and dry.
I think without seeing you, the best thing is cleanse, moisturize, medicate. And even patients with oily skin can benefit from moisturizing because it replaces what's there with something that should be there. Acne, I like all of my acne patients to be on a retinoid-containing medication. They can be drying, which is why moisturizers are really helpful in those specific scenarios. And I really believe in creating personalized plans for patients. So when a patient comes in, I evaluate their skin, I determine what the best course of action would be, and then together we make a plan for you to achieve your skin goals.
Thank you. Glamazon Body says, hello.
I love the Glamazon, by the way. What a great name. If they were from Brazil, that would be perfect. Okay, go ahead.
Yeah, they just said hello. And then, are retinol and vitamin C okay to use together? How do you feel about the combination for helping acne?
Ooh, for acne, not necessarily for anti-aging.
I think they're great to combine. You can do your vitamin C in the morning. It's a nice antioxidant. It will help help protect you from the sun, and do your retinol at night. Now, if you actually have acne, you may be better served with prescription retinoic acid. So retinol is a weaker version and available over the counter of retinoic acid, which is a prescription-only acne medication that Dr. Greenberg alluded to earlier, is also approved for treatment of fine lines and sun-related aging like dark spots. So some patients are better to switch over from an over-the-counter retinol to a prescription retinoic acid.
Glamazon Body said thank you, but no, I'm not from Brazil.
Hey, there's that whole Amazon Valley, so anything in South America?
It's okay.
Okay. Just reaching.
Barack Obama's.
That is a great name. There's a lot of really clever people.
This is on Facebook. And there's several comments regarding this. It says, who's the good-looking fellows behind the camera? Ooga booga. And then Lou Balmari Zacharias Tevez says, requesting all your crew to be in the camera before the live is over.
Oh, we've got a great crew, by the way. I'd like to thank Philip Marcus, who is fantastic. He's a videographer who's worked with Pierce Brosnan, he was James Bond. So Philip and I have been friends for a long time, and I just appreciate him and his daughter coming.
Okay, and then Barack Obama said, yes, bring the crew out. And then I'm so sorry if I butcher this. Sheznarda Aldaz says, any keloid scar treatments? And is there a laser that really erases keloid scars?
No, there is no laser that erases keloid scars. Keloid scars have to be excised, and I like to excise them and then use a topical on top of them called a Micromod or Aldera. We've got a number of videos that we do for keloid removal. The keloids can be excised and sewn up, or they can be excised and just use the topical on them.
Yeah. Treating keloids is one of the most satisfying things that I do in my clinical practice, actually, because they can be painful, they can be disfiguring, can really bother a lot of patients, and it's neat because there's so many different options. There's some patients that are just happy with an injection that softens it, makes it less itchy or painful. There's other patients that they want a normal experience.
Yeah.
And so I have one patient that I treated recently who had a very large keloid along the helical rim of the ear, projecting in a triangle shape maybe 4 or 5 centimeters above the ear. And injecting that wasn't going to touch it. She didn't want it just shaved off and left open because she didn't want to deal with a large wound. So we made a plan to do a large surgical excision with a big flap from behind the ear to reconstruct her ear. And we sent her for post-op radiation therapy to prevent recurrence of the keloid. And I've seen her a few times now, 3-4 months post-op, and it looks absolutely beautiful. So that may not be the right treatment for every patient because it's pretty involved, but certainly we can do a lot. And there were some questions about lasers. We do a lot of laser treatments for keloids as well, combining red lasers and CO2 resurfacing lasers, and using the CO2 to be a laser-assisted delivery system to deliver medications to the keloid without having to inject them.
Yeah, and I have some videos on TikTok, on YouTube, on my Instagram that you can see under H.O. Greenberg. But we have a special guest now. My friend Lisa Song Sutton is the owner of Sin City Cupcakes, and she's running for Congress, and she brought us some cupcakes.
I'm crashing the happy hour, Doc's happy hour,
But show us what you have here so that we know. So these are alcohol-infused cupcakes. And
joining in on the happy hour, of course. So we did 2 dozen minis, and these are our margarita trio over here. So we have strawberry margarita, lime margarita, and mango margarita. And then over on this side is our best sellers mix. So we have the Better Than Sex, which is white champagne, white champagne vodka, chocolate wasted, which is chocolate with chocolate vodka, the No Limit Lemon Drop, lemon with lemon vodka. And then we also have our red velvet back seats, which is a red velvet cake and a red wine Cabernet filling.
Wow.
So we want to bring you guys some treats.
we're going to partake in these while we our happy hour. And Lisa, you can sit in and answer some questions.
Oh my goodness. No, I'm just here to show what it looks like when you are a Las Vegas Dermatology client.
Ooh.
I've been a dermatologist since 2010, and yet I have not aged a day.
We're happy to have her. She's running for Congress, and when is the election?
So June 9th is the Republican primary.
Okay.
So I'm right in the midst of it. It has been changed to an all mail-in ballot for the primary. So if you are an active registered voter, you will be receiving your mail-in ballot via mail from the Secretary of State's office starting actually in about 10 days. So throughout the month of May, people will be getting your ballots and hopefully voting for me.
Yes.
And yeah, it's just been an incredible experience.
That's fantastic. Thank you
Which one should I try?
Well, what are you going to move? What
I
you're
think I'm
drinking?
gonna try this
Where's
one.
that go now?
Thank you,
So it
Lisa.
goes hand in hand with that, of course.
Okay.
Pleasure.
Glamazon Body ended up saying, I'm an esthetician just here to listen on the docs talk my language about the integumentary system. Integumentary. And then she said that was a great question about the keloids. I'd love to sit in on an excise procedure.
Yeah,
And then
well,
she said, the cupcakes look awesome.
We have had some people come, both Dr. Cotter and I work with UNLV, and we've had residents and students. People come in and observe, and that's how Dr. Cotter and I first met. I gave a lecture at UNLV. He was an intern, and ended up with me during that intern here. We've kept in touch ever since then.
Oakley dokley. So
Delicious, by the way.
They look really
absolutely
good.
delicious.
Okay.
I'll try another one.
I won't eat all of them, but actually at lunch this morning, I ate something I was allergic to, and I had this massive total body hive reaction. I was red.
Oh, it was scary.
And I took 20 milligrams of Zyrtec, 25 milligrams of Benadryl, and 40 milligrams of prednisone, all within like 20 minutes to try to get back to normal.
We're just happy to
So
have him here.
as delicious as these look, I'm really nervous to touch anything right now.
You're hypoallergenic. It's only bad if you're allergic to alcohol. It's absolutely delicious. This is my second one.
They look really good.
They are
Yeah,
absolutely
it's also in the
fantastic.
fridge. They
smell
cook really
delicious
well.
too.
Ah.
We have staff here, they'll all partake.
Awesome. So Deborah Robertson's Levana Way says, any treatment for teenage dancer with horrible stretch marks on her hips down to her inner thighs and past her knees?
Stretch marks are so challenging to treat. So a few things about stretch marks. One, if they're red stretch marks, the redness will fade over time. A tincture of time will do a lot. But then what you're left with are atrophic stretch marks, meaning kind of white and sunken in. Both of those are very hard to treat. I always tell all of my patients who are interested in embarking on a stretch mark treatment journey with me is that the results will be minimal, it will take a very long time, and it is generally very expensive because of the amount of time and labor-intense nature of treating them. But I combine multiple different lasers, sometimes even microneedling, and sometimes pitch plasma as well to give patients the best results. And just honestly, it's tough, and I turn a lot of patients away because expectations don't match the reality of where we are from a technological standpoint right now to actually treat stretch marks. So I'm sorry that's going on.
Yeah, there is nothing great, but for red ones, like you said, pulse dye laser, I've gotten into doing a pulse dye laser followed by a CO2 laser, charging one price to do them both at the same time.
Exactly.
Okay.
Even Venus Viva can work. That's the radio frequency that we had discussed previously.
Yes. Suzanne Seidella is asking a question for Janice McAllister Fleming, and she wants to know, she has a red spot on her back, and it comes back and it goes. So could this be cancerous?
Well, usually cancer doesn't come and go, which is the good news. There are some rare exceptions. Things that come and go are more likely to be along the nature of maybe a rash. Those can come and go in the same areas. Sounds like it's something that needs to be seen, and maybe even amenable to a telemedicine visit, as long as it's there.
There was we were in a dermatology chat room, and there was a certain singer who, whenever she went to a different city, got a spider bite in the same location. It may not be a spider bite.
Cat Bird is actually asking, what was our guest's name again, and is she a Republican or Democrat?
Her name's Lisa Sutton. She's Republican. We've been friends for a long time, and I don't know. Do you want to say something about your run for office? What your goal is?
Sure. Yeah, as you said, my name's Lisa Sutton. I'm a Republican running for Congress here in Nevada's District 4. District 4 is essentially northern Clark County, and then it goes all the way up to Urington, Nevada. So it's the largest in landmass in the state. It encompasses 7 counties, one which is Clark, and then the other 6 are all rural. So we're really, it's really a very mixed and diverse district, and so I'm very grateful for the opportunity.
She's a small business owner, so as somebody involved in small business, and with what's going on now with the virus and seeing all of the small business owners really suffering, I think it's important that we, I'm happy that she brought the cupcakes. We paid for the cupcakes, and she was kind enough to deliver them. But even last night, I ordered in some food, and it's a really tough time. So everybody's doing their best. And
absolutely, yeah. I speak to voters and small business owners every day, and everyone is experiencing this in a different way. Communities and industries are being impacted in different ways, and the common denominator though is that we really are Vegas strong. I mean, everyone I talk to, is looking for that positivity at the end of the tunnel. They're looking for when this is going to be a memory, and so that's what people are focused on.
She then said, "You've got her vote."
Oh, thank
Oh,
you.
nice job.
You can learn more at
Annalise Cordens on Instagram says, "What's your favorite preventative treatment for people under 30? I want to start the anti-aging journey before I need it."
My favorite preventative thing is sunscreen and our prescription-grade retinoic acid. And for my patients that are looking for kind of a more elegant cosmeceutical version of a prescription retinoid, I really like one called Altrino, which is 0.05% retinoic acid plus it's specially formulated in a nice hyaluronic acid-based lotion. So you get the HA, you get the retin A. It's very soothing. People can use it regularly. And then beyond that, we can start adding in injectables. But I start everyone there.
yeah, I agree. Sun protection, sun avoidance can't be understated. And then all of the stuff that we talked about: radio frequency, microneedling, laser resurfacing. It's a little young at 30, but you wouldn't be the first one.
And Botox to prevent those wrinkles. So you can use Botox to prevent dynamic lines, which are the lines that are present when you're moving. from turning into etched in lines, which are lines that are present at rest.
On your Instagram, Brianna Cotter says, David, please bring one home, vanilla lemon drop, yum.
They are absolutely fabulous.
Which one was the vanilla?
Can somebody get my napkin?
With the lemon head on it.
This one, okay, so I called dibs here. It
You
looks
heard
delicious.
it. You got it. Dan J. Russ Girl says, love my CO2 laser treatments, Dr. Cotter. Can hair removal treatment be applied to this at the same time?
Yeah, I love combining lasers on the same day, and you just have to take a dedicated and a learned approach to combine them safely. And certainly we could do laser hair removal on the same day as CO2 laser. I would just combine them. I mean, that I would probably do your laser hair removal first, and then I would do the CO2 afterwards. One thing I do a lot of is I combine either my pulse dye laser for redness on the face for people that have many broken blood vessels with the CO2 laser, or I'll do the tattoo removal laser for brown spots on the face and combine that with CO2 on the same day. Always doing either the red or the brown laser first and following with the CO2. But absolutely, that's a great treatment combo.
Yeah, and I've really gotten into the PRP. I posted something on my Instagram last night when I gave a talk at Cosmetic Surgery Forum, which is Joel Schlesinger is a dermatologist in Omaha who has assigned this forum. It used to be here, now it's in Nashville, and gave a talk on the uses of platelet-rich plasma to regrow hair and as an anti-aging procedure. Yeah. So PRP is really a helpful add-on.
Brianna said thank you. And then Valerie _Bugney says, Nana wants a cupcake too.
Well, everybody wants one of these cupcakes. They are fabulous. I just need a napkin.
If Dr. Greenberg sees it.
I'm doing my best to eat as many as I can.
That's nice. That'd be nice. Yeah. Good. Special rewards club.
Every 10 units of Botox, you get a cupcake.
My favorite here, honey. Sweet. Sorry. Okay. It says, my daughter is extremely frustrated dealing with her teen acne. She would like to start a holistic approach for treatments first before doing anything, especially in hard to reach areas like the upper back. Do you have any advice in holistic treatment?
All right, can I give a holistic one?
Sure.
So there was a study out of Stanford where they showed that the students who were doing final exams, and this wasn't this year because who the heck knows what's going on, but they had more acne than at that point in time than any other point in time. And stress can cause acne, and that's possible. So yes, reducing your stress may help with the acne, but if just the reduction in stress, be it through psychotherapy or meditation or yoga or something else doesn't work, there's a bunch of medications, and that's where we deal with it.
Yeah.
We aren't seeing people who, we may discuss those things in the clinic, but ultimately we're the ones who are prescribing medications, FDA-approved medications for your acne.
So I think of holistic as all-encompassing. So not necessarily just medication, not necessarily just lifestyle management, but combining the two, because holistic means the whole. So we should do it all to get patients to their best skin. And a few things you can do from a non-medical standpoint. There have been a few studies that have shown that drinking skim milk instead of whole milk on a population-based level may increase the chances of having acne. Also, eating excessive refined sugars may increase the chances of having acne at a population-based level. Maybe not true for any specific person, but if you look at thousands of people, that can play a part. So
Our cupcakes do not create acne.
Perfect. That's good. Hey, they're hypoallergenic.
They're hypoallergenic.
these are all natural. It looks really good.
It's absolutely delicious.
Oakley dokley. Jennifer Walsh said for the preventative, sunscreen and what acid? Could you please repeat?
What?
For anti.
Oh, so for the preventative, so I recommend always sunscreen. I think that was the first part of the question, but the second is what acid. So I usually recommend a retinoic acid, so a prescription grade retinoid, and they come in a lot of different flavors, and they go by lots of different names. The generic name for this general class of medications is tretinoin, and that's been branded as Retin-A Micro, Renova, Rifisa, I think, and then the one that I like the best right now is Altrino. But there's many different ones, and some are better than others for any specific patient, so we pick the one that's best for you. There's over-the-counter retinols, which are the weaker version of the prescription-grade retinoids.
Yeah, we sell Nuville in the office, which is why I need.
Enchanted Dahlia said hi.
Hi.
Jennifer Walsh also said thank you, and then she also has another question that says, I have teensy red spots, very blood red on my chest. What treatment would I need to do to treat that? I also have melasma too. Can the treatment be for the teensy red spots combined?
Well, so it depends on the nature of the red spots. If they're teeny tiny red dots, little cherry angiomas, which it sounds like they could be, or maybe little spider angiomas or broken blood vessels, the best thing to do would be to use our pulse dye laser. But there are a few medical conditions that can lead to increased redness of the upper chest. Sometimes they're autoimmune diseases, can give you kind of what we call a poikilodermatous rash. One's called dermatomyositis. Sometimes lupus can give you a similar rash. Sometimes radiation damage, if someone's had radiation for breast cancer in that area, can lead to that change. Chronic radiation dermatitis can look like that. So it's really important to make sure that there isn't a bona fide medical diagnosis that needs bona fide medical treatment before you embark on any cosmetic treatment, which is why I always recommend to my patients to see a board-certified dermatologist, whether you're going to have your cosmetic treatment with me or not. I know there's a lot of different folks in town doing different treatments, and they do great jobs, but it's very essential to make sure the diagnosis is right before you start on any treatment. I have friends that are world-famous laser providers, laser doctors, and they've seen cases of melanomas treated with laser that have delayed diagnosis and patients have died. One of my good friends, Dr. Arya Vizirniak, he's at Mass General Hospital right now, and he had a consult earlier this year for basically exactly that, increased redness, wart-like lesions on the hands, and that patient actually had dermatomyositis. So it was a good catch from Dr. Vizirniak, but it just reinforces the fact that you have to make sure you know what you're treating before you treat it. In terms of melasma, it's also difficult to treat, but there's a variety of different options. And one that I've been using a lot more frequently in patients that don't have a reason not to use it is oral tranexamic acid.
I was just going to ask if you were doing that.
Yeah, so I'm doing oral tranexamic acid for a few patients. The biggest concern is that medicine can increase the risk of blood clots. It was originally used for menorrhagia, so what it does is it causes blood to clot. But there's been great data sets coming initially out of some of the Asian countries and now spreading around the world in the last few years, showing that twice daily tranexamic acid for short courses anywhere from 6 to 12 weeks can really improve melasma. But again, for me, it's always in combination with sunscreen.
And then just a general warning, you guys have about 4.5 minutes for your lives.
Oh,
all right.
Time flies.
So is there one or two final questions?
There's a final question from Glamazon Body that asks if you guys need an added esthetician for your practice.
Well, at this current time, there's not a lot of people coming into the office. We're doing a lot of telemedicine visits, just because a lot of people are afraid to come in. This is breaking news. Just got my test results back because I was sick as a dog in December, beginning of January, and it turns out that I was actually COVID positive. So back in December, January. So I do think it was related to CES. I do think it was related to people coming over. I now am IgG positive. So the IgG means that I have been exposed, but I'm not currently infectious. But
yeah, it's exciting.
So are you guys looking for an esthetician?
Are we looking for an esthetician? No, sorry. When this ends,
I'm looking at
thank you. Thank you for keeping me on track.
Got her vote.
This is always on point. So yes,
Ooh.
we will be looking for one as business increases, as we get more volume.
As we start adding back those
as we bring our full staff back up to working, because right now we're just doing a lot of telemedicine and then essential dermatology visits. We've seen a lot of stuff during this outbreak that we're going to write a paper on about some of the essential things that we've seen that would have gone unrecognized otherwise. We're seeing a lot more sick people with a lot more severe skin disease during this COVID outbreak, during this quarantine, than we've seen otherwise.
Do you think it's because they're staying at home, or what's the...
I think there's a couple of different things. I think one, when someone has a severe acute skin condition, their first thought is, I'm going to go to the emergency department or urgent care before looking for a dermatologist. But right now, a lot of people don't want to go in.
They're horrified.
Even if you're having like life-threatening chest pain, people want to stay at home.
Right.
So I think part of that has driven some of these patients into our derm practice instead of going through emergency department, then to derm. And then a lot of other practices have closed doors. Many people in town are still doing telemedicine, but other people around the state, some aren't. I've had patients fly in from Reno with severe skin diseases, the greater Reno area, because there was no one there.
How many Telederm did you do today?
I think I did 8 or 9 today.
Wow.
I did a lot.
Yeah, I've done like 4 or 5. And it's a lot more popular. Again, people just don't want to leave the house. Now that I know that I'm positive, I want to wear something on my chest so that I can
That
just
you
walk
was
around.
positive.
No, I was exposed. So
Yeah.
now I should have antibodies. I'm going to donate some plasma and see. I put a text out I'm on the Clark County Medical Society Board of Directors, and I just texted the president of the board to see, well, what can I do now? How can I, contribute, maybe donate my plasma to help people.
Jennifer Walsh says, so glad you're now healthy. Makes me more comfortable to come see you. Anna Elise Cordon says, does SPF have a limit as far as the number it goes? I just saw SPF 100 sunscreen.
Oh my God.
Yeah, so sun protective factor, that's what SPF stands for, and it's basically the percent decrease in the amount of UV rays that get to your skin. And it's measured in this really bizarre artificial way in a lab essentially, where they shine a UV light on skin and they determine the amount of time it takes to make the redness appear. And they put SPF on and they factor in basically a division problem of how much longer it took, and that's how they calculate SPF. So the higher you go, the better. The AAD recommends at least 30.
Yeah, and we have a couple that we sell here in the office. I think both Dr. Cotter and I agree that we like the zinc oxide, titanium dioxide products that reflect the sun's rays better than the ones that absorb the sun's rays, which are physical chemical blockers.
Awesome. Last comment says, let the front and back office crew out before it ends.
In any case, I think we should. This is a good place to wrap up.
Yeah, I think so. Thanks for tuning in this week, guys. Hope to see you all again.
Yeah, we'll do another round. We'll go for round 3.
Maybe we'll take some topical suggestions for specific topics. If people want to hear more about psoriasis or atopic dermatitis, skin cancer, autoimmune disease, I think that'd be a fun. Maybe we could do a focus or maybe just some interesting cases from early Derm.
Yeah, I think that'd be great. We've got a lot of really cool cases. We've got great patients. We've got a fantastic staff. I'd like to thank Philip Marcus for coming here to do the videography. I'd like to thank Lisa Sutton for
Thanks for letting me
Thank you.
crash.
Yeah, this looks so good.
bring these absolutely delicious, wonderful cupcakes, and wish her good luck in the upcoming election.
Oh.
I think-
Stacy Malaris is begging, please answer this last one for treating molluscum for pediatrics.
So I use cantharidin for almost all of my pediatric patients. It's a little blister-inducing agent that's derived from beetles, Litter vesicatoria, and it works really well. Usually in multiple treatments, you don't have to treat molluscum in pediatric patients. It will go away on its own in most patients over months to years. I don't do that treatment on the face because it leaves dark spots if they have them on the face. I usually recommend kind of an irritating exfoliating cream or an acne medication.
Yeah, and molluscum is a pox virus transmitted from person to person by touch. It's similar to a wart. We also sell molluscum RX in the office, which is a topical that you can get at the front office.
Enchanted Dahlia wants to leave you guys off on, I'm just thankful to have a doctor who got to the root of my skin issue after 2 months. I finally am starting to feel like myself. Thank you to his entire team.
Oh,
Well, thanks, guys.
Awesome.
Thank you, everybody, for joining. We appreciate it. And we'll
Leave
be
your
here
comments.
in the next week or two. Feel free to reach out to the office. The staff is still here. 702-456-3120 is our number. For Dr. David Cotter and myself, appreciate your coming by.
Take care.
Awesome. Bye, guys.
Bye.
Yay.